HbA1c, also known as glycated hemoglobin, is a laboratory test that measures the average blood glucose levels over a prolonged period, typically 2 to 3 months. It assesses and monitors long-term glycemic control in individuals with diabetes mellitus. The HbA1c test provides valuable information about a person's average blood sugar levels, reflecting their overall glucose control over time. To understand the significance of HbA1c, let's break it down further. Hemoglobin. Hemoglobin is a protein found in red blood cells responsible for carrying oxygen throughout the body. It binds with glucose in the bloodstream. Glycation. When blood glucose levels are high, excess glucose molecules attach themselves to hemoglobin. This process is called glycation. The higher the glucose levels, the more glucose binds to hemoglobin. HbA1c. HbA1c refers to the specific form of hemoglobin that has glucose attached to it. The HbA1c test measures the percentage of glycated hemoglobin in relation to total hemoglobin. It provides an estimate of the average blood glucose level over the previous 8 to 12 weeks. The significance of HbA1c lies in its ability to provide valuable information about a person's long-term glucose control, which is crucial in managing diabetes. Here are some key points. Diabetes diagnosis. HbA1c is one of the diagnostic criteria for diabetes. A value of 6.5% or higher on 2 separate tests indicates diabetes. Monitoring glucose control. For individuals with diabetes, HbA1c is used to monitor and assess their blood sugar control over time. Regular testing helps healthcare professionals evaluate the effectiveness of treatment plans, medication adjustments, and lifestyle modifications. Treatment planning. HbA1c results guide healthcare providers in making treatment decisions. The target HbA1c level varies depending on factors such as age, overall health, and the presence of complications. A lower HbA1c goal indicates tighter glucose control, which can help reduce the risk of long-term complications. Long-term complications. Studies have shown a strong correlation between elevated HbA1c levels and the risk of diabetes-related complications. Complications of diabetes could be microvascular or macrovascular. These complications can affect various organs, including the heart, blood vessels, eyes, kidneys, and nerves. By maintaining an optimal HbA1c level, individuals with diabetes can minimize the risk of developing or worsening these complications. Treatment adjustments. If HbA1c levels are consistently elevated, healthcare providers may consider adjusting the diabetes treatment plan. This may involve medication changes, insulin therapy initiation, or intensification, and lifestyle modifications such as dietary adjustments and increased physical activity. It's important to note that while HbA1c is a valuable tool for long-term glucose monitoring, it doesn't replace regular self-monitoring of blood glucose levels. Regular blood sugar testing, such as fingerstick measurements, provides real-time information about glucose fluctuations, which can complement the HbA1c results. Overall, HbA1c is a critical measure for assessing long-term glycemic control in individuals with diabetes, guiding treatment decisions, and reducing the risk of complications associated with diabetes. Regular monitoring of HbA1c levels helps individuals and healthcare providers optimize diabetes management and promote better health outcomes.